Coming up on the Doctor's Hospital podcast.
10 to 15% of children experiences anxiety and depression, and then which follows from that is there are a lot of suicidal or non-suicidal self-injurious behavior, which is what we call cutting.
Seeking exceptional healthcare beyond the traditional hospital setting? Introducing Doctor's Hospital Clinics, your trusted destination for comprehensive care. Our full-service locations provide affordable services through our Loyalty Advantage membership program and NHI. Experience seamless care with our integrated health system, where your medical history travels with you, ensuring continuity of care. Book an appointment today at clinics.doctorshosp.com. We make primary care easy.
Welcome to the Doctor's Hospital podcast. I'm your host, Marketing Director at Doctor's Hospital, Alexis Burrows. And today we are talking about suicide prevention. This past Tuesday was recognized worldwide as World Suicide Prevention Day. So we are joined once again by Dr. Thomas Smith, who is one of our psychiatrists here at Doctor's Hospital. Welcome back to the show.
Good afternoon. Thank you for having me.
And we are glad to have you back on to talk about a very important topic. I think that, suicide and suicidal ideation and a lot of those sorts of topics are a bit taboo, and people don't necessarily like to talk about them, especially in public forums. But I think it's important to kind of have this conversation. There's not as much public data as there probably should be on the rates of attempts and successful attempts and things like that. But we do know that there is an issue that exists with, I think, an uptick in the amount of attempts in the past few years coming out of Dorian, coming out of the pandemic, things like that. So we wanted to get an opportunity to sit with you and just kind of talk through, the process. If you're someone who, may have ideation, if you're someone who has a family member or friend who has ideation or has attempted or anything along those lines, just as a way to provide support. Obviously, the intent of this is to, as far as possible, where we can intervene and provide tips and assistance for prevention, that's what we want to accomplish with this conversation today. So we are happy to have you on to help us walk through that. I know before we started, you indicated that this is not a conversation with perfect answers. I think in a lot of other medical spaces, you tend to find that, if you do this and you do this and you do this, it's kind of this perfect foray into what happens next. So we appreciate that, understanding that going into the conversation. But again, looking for just ways to kind of help people navigate what can be very dicey waters.
Yes. Thank you for that very thorough introduction. And it is a very morbid subject matter. Among Caribbean people of color, we and very conservative and very religious. That sets the backdrop as to how suicide is discussed or even managed locally and regionally among our people. I'm sure the numbers, the actual data numbers don't represent all of those that are done. And that's because people tend not to want to think of their loved ones as having taken their own lives,
right?
Which sort of is a very short way of looking at it. And I think that's what this dialogue is about, is along the road of very hopeless suffering, the end result sometimes, unfortunately, leads to self-injury, death.
Right. So, like you said, it's going to be an interesting conversation to navigate. It's probably one of the heavier ones that we've done since we relaunched a podcast earlier this year. But I think, with something like this, we want to start at the root. And I think the first question is, what are some common warning signs that someone may be at risk for suicide? So this is from the standpoint of a family member or a friend or a loved one. What should you be on the lookout for if you think someone is potentially at risk?
Right. So we're going to speak about it as it relates to the Bahamas, and
Fair.
Right. So again, when we say common signs and warning signs, that too depends on the population that you're speaking about. Young people would probably have a whole lot of uh, antecedent behavior that indicates that they're really suffering.
Mm-hmm.
Um, Older persons who are suicidal may have a little bit more withdrawn and more depressive symptoms that would be easily picked up on.
Mm-hmm.
And then young adults will probably see a whole lot of other bad coping skills like
Mm-hmm.
over drinking or use of substances. But generally speaking, there are some clustered behaviors that indicate that people are beginning to think about self injury or suicide. And a few common ones would be when they start thinking or expressing thoughts of dying,
Mm-hmm.
right? In some ways, what I'm about to say mirrors some of the symptoms of the most common reason people commit suicide, which is depressive symptoms,
Mm-hmm.
right? So when you hear people talking about death and dying, that's one of the key signs that maybe something is not going well with that person.
Mm-hmm.
When you see people are acting in a way that they're not coping well with stress, they're withdrawing from people. That's another telltale sign. Another, you might see some people acting in a very lethal way, right? Perhaps driving recklessly,
Mm-hmm.
walking late at night in dangerous areas, playing with lethal weapons,
Mm-hmm.
or that too are is one of those common warning signs. Or they might just simply say, "I just don't feel like living anymore,"
Right.
right? And then too, you will see them withdrawing, like I mentioned before, or perhaps you will see an uptick in substance use. That is usually how people are trying to, I don't know, manage their overwhelming psychic pain that they're
Mm-hmm.
suffering from. When people lose hope, when people feel overwhelmed and crushed by no way out, when people aren't able to figure out the out of this impossible situation,
Mm-hmm.
then they tend to think about ending it all.
Right.
Yeah. So just to recap, look for the withdrawal person, look for persons who are usually talking about dying,
Mm-hmm.
look for persons who are expressing that they want to die, look for person who might be depressed,
Mm-hmm.
look for person who taking unnecessary life risks or deathly risks, look for persons who might be using the substances more than usual,
Mm-hmm.
those kind of things.
Right. I know I've trying to do some research before our conversation. I know one of the things that I came across as well was people I guess drastic changes in behavior
Yeah.
and losing interest in things that they once had interest in. So if you had someone who was like an avid sports fan and they would watch as many basketball games or football games as they could, and then you see that they have zero interest, it's just completely gone away. Like things like that are also you can correct me if I'm wrong, but from what I read, I understand that things like that are also part of potential warning signs.
Exactly. And again, though some of the symptoms tend to mirror much of the symptoms of depression,
Right.
right? So what you're just describing is loss of fun or loss of interest in things that they usually enjoy, or
Mm-hmm.
the medical term we use is anhedonia, right?
Mm-hmm.
And and anhedonia speaks to someone who's been just lost interest in having fun. They're depressed for about, or they're sad for about 14 days or so. And the interesting thing about suicide is that the pain, the psychological pain that they're going through, uh, tends to make them think that there is no way out, right? And that the way out is to end this life. It's a very irrational way of thinking. And that's because the thought process is just overwhelmed by the
Yeah.
emotional psychic pain they're going through.
Uh, so you know, if you see I guess the natural, logical next step would be is if you see a loved one, a family member, a friend who's exhibiting some of these warning signs, how do you approach that topic with them if they seem to be struggling and you think that they might be contemplative in that way? how do you, as a family member or a friend or a loved one, how do you approach that?
Right. And that's a very good question. And I think we need to emphasize that a lot of the times there are warning signs that indicate that persons are not doing well and not
Mm-hmm.
coping well. And so if you're a family member of someone who's thinking or suffered from suicide or thinking about suicide, or perhaps are known to have high risks of suicide, because
Mm-hmm.
that's another strata that we can look at, here are some things that you can do that can reduce the possibility of the end not of that bad end not happening.
Mm-hmm.
Bearing in mind that if someone is suicidal, right, and they're intent on killing themselves, there's very little, if anything at all, that we can do that might stop them from doing so.
Mm-hmm.
Okay, so but uh, and what I've come across and what literature says that we can do well when we try to support them. And that psychosocial support would be just checking in.
Mm-hmm.
Hey, I've noticed that you've not been coming around like your usual self. Are you okay?
Right.
Right? What's up? You're not playing basketball with me anymore.
Mm-hmm.
Is anything wrong? Can I help you with things? I noticed that you've been looking very depressed recently.
Mm-hmm.
Most people, most people think, and it's probably not really born in fact, that if I ask you, are you wanting to kill yourself,
Mm-hmm.
that might spur you to do so. But
Mm-hmm.
actually, no, it does tend to open up that discussion. And so if a family member or a loved one that you're coming across is expressing thoughts of suicide, I think what helps them is when you yourself become much more of a support.
Mm-hmm.
You are able to listen to their concern. You are becoming, and you are non-judgmental.
Mm-hmm.
You are creating a safe space for which
Right.
they can share with you their struggle. And because suicide is so personal, suicidal ideation is so personal, you may not appreciate the overwhelming hopelessness that this person is going through. And so giving them that space,
Mm-hmm.
giving them that ear to listen would really help them and appreciate that you do care,
Right.
right? Now that's something that you can do as a layperson. The other thing is, I will say this thing that the term is called signposting. In other words, what you're doing is you're trying to show them where they can get further professional help,
Mm-hmm.
right? So if you're having someone who's already struggling with depression or indicating that they're suicidal and they're thinking, and you feel confident enough that, you know what, this is beyond my uh, ability
Mm-hmm.
to support them, then the very next important step that you must take is referring them or accompanying them or showing them where they can get help.
Mm-hmm.
All right, and of course that depends on the level of the severity of the suicidal ideation.
Right.
If someone is just thinking about it passively, then obviously you want to tell them where they can get help
Mm-hmm.
and encourage them to do so. If persons are more active in their thinking and you know that this is definitely something that may happen once you leave them, then obviously you don't want to leave them alone. You want to take them to get professional help.
Yeah. You mentioned something, and I'm not sure we were pegged to cover it, but you mentioned the concept of what makes someone high risk.
Mm.
Um, Now I know you talk about other sorts of disease. You talk about hereditary and all of these sorts of things, but I'm interested in knowing what would make someone at a higher risk for suicidal ideation or attempts, um, as opposed to someone else. Like what would make them high risk?
Right. When we look at the risk stratification, right, a couple of things comes into mind. Persons who had a horrible childhood,
Hmm.
a childhood full of trauma,
Hmm.
right? Persons who may have had early loss of parents or mom, persons who have a history of a major depressive or a psychiatric illness,
Mm-hmm.
persons who have chronic illness or is having intractable pain because of those things, persons who would have had experiences of uh, losses like life events, such like losing a loved one,
Mm-hmm.
losing a child, persons who may have gone through a divorce,
Mm-hmm.
right? Persons who may have suffered serious financial losses as well. Persons who have substance use that is getting increasingly worse, right? Those are some of the risk factors we're
Right.
looking at. And of course, the biggest one is uh, one of the bigger ones is the gender,
Mm-hmm.
right? Males will definitely be more successful in killing themselves. Persons who are divorced are more likely to kill themselves. Persons
Mm-hmm.
who are older, like between the ages of 45 to 60, are more likely to, they are at a higher risk
Right.
completing suicide. Uh, those are the kinds of risk factors that would put you at risk.
Right. You know, the common through line there seems to be life events that would leave you in a state of hopelessness. And I think you mentioned that at the outset, that a lot of it ties back to this idea of this feeling of hopelessness, and there's nothing I can do to resolve, change, fix, turn around, and therefore that seems to be the common thread through a lot of what you mentioned that would put people at a higher risk.
That's correct.
Yeah.
What well, basically, and of course, I mean, there are multiple reasons
Hmm.
for persons ending their lives, right? Some of which could be, uh, I dare say, rational suicide. There are persons who may have these really debilitating uh, medical problems,
Hmm.
right? Like
Terminal illness.
terminal
Right.
illness, and they conclude that they wish not to endure this and
Mm-hmm.
suffer, right? That's a different kind of suicidal thing,
Mm-hmm.
but nonetheless, it's something. And then there are persons who find themselves in this overwhelming, stressful situation. And because they've never had an opportunity to manage their stress and develop really good coping strategies that are more health restoring than anything, then they're overwhelmed with this monumental psychic pain or
Mm-hmm.
psychological pain. And the only way they can think about getting out is to end their lives.
Right.
Right. So I guess what I am saying is restoring hope is a big part of uh, um,
Trying to prevent it.
exactly.
Yeah. So, what role then does mental health treatment, such as therapy or even medication, play in suicide prevention?
Okay. Right. So um, when we look at what therapy and medication do for preventing suicide, what we are actually saying is that suicide, in some instances, is a result of mental illness. Right
Mm-hmm.
now, I'm going to say something, and I read it once from the WHO, and it made me pause, and I thought about it, and it's true. When we look at suicide, we have to look at it as a separate entity than that of a mental disorder,
Mm-hmm.
right? And what they were trying to say is that the the cause of suicide um, is different from what the person is about to do to end their lives. If we can
Mm-hmm.
stop them from ending their lives, right, by giving them respite or a way to reduce the crisis, that momentary crisis,
Mm-hmm.
then we could work more specifically on the other antecedents like the mental illness.
Right.
So now back to you. So if it is that we're saying that one of the major underlying cause of the suicidal ideation is because of unchecked major depressive disorder, or perhaps someone who's schizophrenic and bipolar, and they've come to this point where they're wanting to end their lives. Then yes, what we would want to do is to first and foremost put them in a safe environment where we're able to manage that critical point in their lives to that's just crisis management,
Right. It's not in the moment.
yes, that's
Mhm.
exactly, reduce that, and that's sometimes meaning removing them from whatever stresses that they're feeling and giving them time to just temporize for a bit. Medication that we would use would probably most likely be antidepressants, which would work, which takes a while before it kicks in,
Mhm.
and as well as what we would say is intensive psychotherapy. And I think the most effective one that has been documented to really affect suicidal or major depressive disorder is cognitive behavioral therapy, what we know
Mhm.
as CBT,
Mhm.
right? We know that dual therapy, which is talk therapy and medication, seem to be the best way to prevent suicide, the best way to mitigate the outcomes of a major depressive disorder
Mhm.
that would lead to suicide. But we want to start early, all right? We want to start early because once someone has already thought or is in the process of attempting suicide, I look at it as a missed opportunity. I
Mhm.
see it as something that has been happening
For a while.
weeks,
Yeah.
months, for a while,
Mhm.
that probably never really got intervened on.
Right.
The early signs were missed, and now we have just a ton of work to do just to get them back to the level where we're trained to teach them to cope well.
Because essentially you're starting intervention at the crisis point
Exactly.
and not at a point where it goes to your point. I think that word unchecked is so important in the conversation. It's the idea that it's an unchecked, major depressive disorder or unchecked, whether it's life challenges, whatever it is, it's that idea of it being unchecked because, you know, I think one of the core tenets of these conversations has been early intervention and prevention, right?
Yes.
And so the earlier you can get professional help involved, then obviously the idea is that better off it would be. It would lead to better outcomes
Yes.
because you have the ability to kind of catch it at a point where it's not at crisis mode. And
Correct.
I think that's the point you're getting at is that if you I think a lot of times we end up, and you can correct me if I'm wrong, a lot of times you end up getting involved in intervention at the point where you might already be at crisis.
That's exactly right.
Yeah.
That's exactly right.
And
Yes.
like I said, it speaks to the idea of things being unchecked.
Right.
You mentioned early on that, this is not something that is exclusive to, adults or even older people, that this is something that's kind of across the length and breadth of the demographics. So, how can, because we're going to talk about, where the other environments that people engage in. So obviously you talked about like potential challenges at home, traumatic events, marital problems, financial problems, things like that. But obviously you have workplace environments and school environments that can also influence and impact how a person is navigating the world, because obviously you spend so much time as a teenager and a child in the school system and so much time as an adult in work. So, how can schools and workplaces create environments that promote mental well being and reduce the risk of suicide?
Very good question. Well, first and foremost, I think let's look at the school setting first and foremost.
Hmm.
I think the biggest way of preventing it is for an awareness to happen,
Hmm.
right? And what I mean by awareness, I think that educators and all those persons within the academic setting dealing with children should be, how do I say this, psychologically literate,
Hmm.
to know when a child is in crisis or when a child is experiencing suicidal ideation.
Hmm.
And so they require at least some kind of training
Right.
to so that they could actually support those kids. Why? Because we know that 10 to 15% of children experiences anxiety and depression, and then which follows from that is there are a lot of suicidal or non-suicidal self-injurious behavior, which is what
Mm-hmm.
we call cutting.
Mm-hmm.
But we know also in that, even within that population, those persons tend to have an underlying uh, uh, um, suicide attempt,
Right.
or can increase the risk of suicide within the year. So there needs to be some awareness. There
Mm-hmm.
needs to be training. um, Teachers and educators need to know what signs to look forward to,
Right.
and how to instill psychosocial support, how to um, support children,
Mm-hmm.
how to create safe spaces for them to talk about how they're emotionally feeling.
Mm-hmm.
And I think you indicated very early on in the conversation of how Hmm. restrictive it is to speak about suicide, because it deals with, the big M word,
Mm-hmm.
mental illness, and all that stuff. And so kids, even young adults, they struggle to be open about those things. And so being able to be aware of it, to make it a commonplace and feel as if this is something that you should talk about, would go a long way in reducing those instances where persons acting without any early intervention. At work, I think it's pretty much the same thing. What we want to do is do the same kind of mental health awareness training, because we know that stress,
Mm-hmm.
anxiety, all those things, they play a part in how people feel about hopelessness, and all of that, and also teaching people resilience, right? And what I mean by resilience, being able to sort out uh, ways in which they can manage certain problems and get bounce right back up again. Of course, some of those persons would require more support than others, but in being able to create that environment will go a long way.
Yeah. So we're gonna get ready to take a break in a minute, but I have one more question before we get there. And it's kind of taking, I guess, the last question a step further. What resources are available? Because you mentioned like training and education for those who work in the school system. I guess for even workplace environments. I guess people in HR, people in employee support or employee health and things like that. What resources are available for those who have access in terms of that sort of space, your guidance counselors, your teachers, your HR professionals, and then as well just for individuals themselves who may be at risk? And then how can family members and friends help to navigate them and steer them towards those resources?
Okay, so this is where I guess I get to plug myself and so for mental health. But I know that there are many persons who are in the mental health field. They offer some training courses. I
Hmm.
know that I've been very active in promoting mental health awareness training
Hmm.
in private businesses, and sometimes trying to encourage the wider population to see the necessity for it,
Right.
because mental illness is so prevalent, right? I mean, the fact is, there is no health without mental health.
Correct.
And believe it or not, um, 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 there's as much as almost 1 in 5 persons who will suffer a mental illness within the given year, right? We know that the two most common mental illness, anxiety and
Hmm.
depression, right? And those sort of kind of suggest that person, and they're brought on by stress and all kind of things. So for me, I would recommend that being able to get mental health training
Hmm.
courses that are offered by appropriately trained mental health professional, uh, being able to get have someone come in to do a lecture to your designated workplace,
Hmm.
connecting with the public mental health departments. There are a few community mental health centers around,
Right.
and also listening to Doctor's Hospital tidbit whenever we do have those mental
Shameless
health
plug.
advice, for sure.
Yeah.
Absolutely.
Yeah. I think that's the thing. it's why we're having this conversation in the first place, right? Is to help bring an awareness and hopefully to help destigmatize the conversation in the first place.
Yeah.
Because I mean, I think you and I and we've had other mental health professionals on. I think back in May, I think it was Mental Health Awareness Month, and we've had similar conversations about the stigma and things like that. So that's a part of the purpose of doing something like this is to help destigmatize it
Right.
in that way. All right, so we are having a great conversation thus far with Dr. Thomas Smith, talking about suicide prevention in honor of World Suicide Prevention Day. We'll take a quick break for some words from our sponsors, and we'll be right back on the Doctor's Hospital podcast.
Looking for the perfect place to fill your prescriptions? Doctor's Hospital Pharmacy is your go-to destination for exceptional pharmacy services. Enjoy low prices on the most common medications, up to 20% off self-pay prescriptions, and fully waived co-pays for insured persons. Try our free delivery service for added convenience. Doctor's Hospital Pharmacy, where health meets affordability. Call us today at 302-4785 for the best in pharmacy services.
Welcome back to the Doctor's Hospital podcast. We are continuing our conversation with Dr. Thomas Smith, talking about suicide prevention and World Suicide Prevention Day. So we'll just jump right back into the conversation. I think you and I, in our first iteration of the podcast back in May, talked about the issue with the stigma around mental health. How has, in I guess from your vantage point, being directly in the field, how has the stigma around mental health and suicide evolved, and what can we do to further reduce the stigma associated with it?
Right. So again, as a people, we're very a conservative people,
Mm-hmm.
right? And suicide or dying by your own hands has a lot of spiritual and religious overtones to it. Also, um, the fact is, sort of kind of inadvertently, it's an acknowledgement that it's a very dark and painful place, not only for the victim,
Mm-hmm.
but the pain it leaves behind for the
Mm-hmm.
loved ones, right? And so we haven't been really good at intervening uh, when it comes to suicide or preventing for a long while. What I do believe, though, is that the more we have these kind of conversations, the more we share that people are going through an incredibly painful period and they're feeling hopeless and overwhelmed, the more we suggest that there are things that we may be able to do that lessen the chance of this happening, the more we practice or teach people how to cope, the more we create safe spaces,
Mm-hmm.
the more we check in on each other, the more we lower the risk factors, managing our stresses better. I think the easier it will be for us to talk about mental illness and suicide. So I think that's the way forward for us, being able to speak to it as simple as, just like how we talk about, I just had a cold or cough today.
Right.
Um, and I think that would probably come with checking into a mental health professional,
Mm-hmm.
not necessarily a psychiatrist,
Mm-hmm.
but a counselor. That could be your priest, that could be
Mm-hmm.
your pastor, that could be your designated workplace employee, assistance programmer. Um, um, but making certain that mental health is a part of your everyday life would definitely make an impact on how we talk about suicide, depression, and mental illness.
Right. It's interesting because I feel like there's an inflection point um when you talk about, I guess, being more comfortable with talking about the idea, right? And I say that from the standpoint of kind of going into our next question, which is, what impact does social media and technology have on, you know, I guess suicidal ideation and attempts and things like that. And it's from the standpoint of, we exist in a space now, especially post pandemic, where there does seem to be a general idea of more openness talking about, people saying, well, I'm going to see my therapist, or my psychiatrist, or whatever the case may be. There's an openness there. You have people who are using online platforms that offer help and things like that. But then you also have, kind of at the same time, there's a lot of things where people say, well, I might as well just like self exit and things like this, where you're not sure how to frame and how to view those things, because do you view that as someone who's actually having ideation? Like, how do you navigate all of that as well? So what impact does social media have in this space, as people, as all of the way we communicate with each other, everything evolves?
And I think the way how you just describe it shows how very complicated
Mm-hmm.
and difficult it is. On the one hand, social media and technology has done tremendous things for mental health in terms of developing more awareness,
Mm-hmm.
uh, creating even further safe spaces for specific groups,
Mm-hmm.
right? Being able to have that pathway and referral pathway to the appropriate help through apps and other different platforms,
Mm-hmm.
right? So the services, or to be able to connect to the professional, mental health professional, is much easily sought after or traversed than before. And on the other hand, there's the dark side of how suicide is promoted
Mm-hmm.
on the same platform,
Mm-hmm.
right? How it is advanced in a negative way that doesn't stop to mitigate the
Mm-hmm.
problem, but actually worsens it,
Right.
you know? And so I guess um, as a tool, there's an incredible way the platform of technology and media could help to address ways in which they can impact on mental health positively.
Mm-hmm.
And I think we need to be on top of that almost every day through advising, flooding the waves or the technology platforms with appropriate, clear data based information,
Mm-hmm.
and holding people responsible for the negative impact that they may have on these platforms that can worsen someone's mental illness or even exacerbate a person suffering from suicidal ideation or suicide attempt. Yes.
Okay. um we've talked a lot in this space about prevention. And you mentioned earlier that a part of this conversation also revolves around, when someone has successfully committed suicide, the family members, the loved ones that are left behind. How can individuals who've lost someone close to them to suicide find healing and support? What resources are available to people in that space? And then, what should just the general community understand about navigating that type of grief?
Right. So when a loved one is uh, lost by suicide, the pain is tremendously overwhelming for the surviving family members. I think there's a lot of guilt that is left behind.
Mm-hmm.
I think there's been expressed uh, a feeling of uh, surprise, because sometimes people really don't know to what degree their family member is suffering.
Mm-hmm.
There's a whole lot of denial as well, and there's a lot of blame. Right.
Mm-hmm.
What's important for family members to know is that um, they must know that um, suicide is a choice that they themselves did not make,
Mm-hmm.
and that they really should not blame themselves for an act done by the victim. They must know that the victim, in choosing suicide, was was more than likely going through a lot of psychological difficulties
Mm-hmm.
and overwhelming hopelessness, um, and that they probably was suffering a whole lot that made their choice a bad one.
Mm-hmm.
Okay. um, um, I would advise that family members who are survivors from someone who's committed suicide attach themselves first and foremost to support groups
Mm-hmm.
that who have likely members or who would have had similar losses.
Right.
Grief counseling is good
Mm-hmm.
because when you lose someone, there's a whole way of redefining things,
Mm-hmm.
redefining purpose, redefining your life,
Mm-hmm.
redefining their past life,
Mm-hmm.
and so just to just to um, re-engage or just to be realigned, I guess would be the better way
Right.
of saying that. Support groups really do help. Talking to a mental health professional can help.
Mm-hmm.
Taking care of yourself um, will help. Recognizing that um, it was, it probably had nothing. There's nothing that you could have done
Right.
that could have prevented that. I mean, that's difficult to say, but it probably comes down to that. Again, not every suicide is the same as the other one,
Mm-hmm.
but I think the family members has been documented and reported by a lot of survivors of it, or victims of it, um, who had their loved ones died by suicide. They take on tremendous guilt, and I
Mm-hmm.
think there's always this burning uh, idea that if they had acted soon,
Right.
or if there was something else that they could have done to prevent it. um, and it's a very difficult spot. And being around persons who had similar experiences will give you some idea as to the way forward,
Mm-hmm.
right?
Yeah. I mean, I think it's the same as any other, I guess, potential like terminal illness. You know, you have support groups for cancer survivor groups, all of these different things. So I guess going back to the point, of mental health being health, you kind of you take the similar approach, right?
Yes.
And it is interesting, I think people go through a process even in grief for losses by natural means and other means of rewriting and redefining.
Mhm.
And I imagine it might be even more challenging in the space of something like this, where there's a lot of opportunity, like you said, for guilt and taking personal blame, which while is a natural part of the process, you want to be able to help people navigate that and be able to kind of come out on the other side successfully.
Exactly.
Yeah. So we've talked, I think, a little bit back and forth from a micro and a macro level about this conversation. I think, as we wrap up, I think one of the big questions is, you mentioned resilience earlier, and if you navigate the online space, one of the things you hear a lot of people talk about nowadays is, well, I don't have the capacity. I don't have the capacity for this. It's like, I have work and I have 2 kids, 3 kids. I have, I'm involved in this extracurricular or this thing outside, and everybody talks about this space of not having the capacity. And in some ways, I think that kind of translates into not having the resilience of being able to navigate and manage all of these things. But what are some long term strategies for building resilience and promoting mental health in both individuals and communities that can help reduce the risk of suicide?
Yes, and that's an excellent question. And I was, as you were saying it, it just struck me that um, today's life, in this very integrated, connected world, um, is a risk. It's a
Mm-hmm.
risk. It's very heavy on time and outcome.
Mm-hmm.
It's almost 24 hours round the clock availability.
That's the thing. It's connected and
And
disconnected at the same
yes,
time, right?
yes,
So it's like
yes,
you have all of these digital methods of
correct.
connectivity, but you have a lot lacking in the physical connection.
Exactly
And I
right.
feel like again, coming from a very layman's perspective here, right? But the idea being that we need human connection, and a lot
Correct.
of times I think that might get lost in, well, I could just like send somebody a message or a WhatsApp, or just post on their Facebook or their Instagram. And then obviously the flip side of this overconnectedness is, well, your workplace can reach you at any literal second of the day,
As they do sometimes.
as they do.
Right.
um we're not going to talk about toxic work environments. I think
Right.
we,
No,
we
we're
kind of,
not doing that.
but you understand the idea being, there's a lot where it's like you're connected, we're more connected and less connected at the same time.
Exactly right. And that's the sort of crazy thing about it. And why there is now a rise or raise or whatever
Mm-hmm.
in loneliness.
Mm-hmm.
And loneliness is now being considered a possible diagnosis in the next DSM-5. So I've heard DSM, right? Because it's such of our it's just our life living right now. So what I think, back to your first question, what we need to work on is being able to return to that work life balance,
Mm-hmm.
right? And when I say work life balance, really cut off those gadgets.
Mm-hmm.
Don't answer those emails on the
Mm-hmm.
weekend.
Mm-hmm.
Don't take that phone call after 5, right? Which I know for some of us, it's absolutely impossible,
Right.
right?
Those are usually the worst
Right,
ones.
right.
The post 5 o'clock and the
Yeah,
weekend emails and phone calls are
yes,
usually the
yeah.
worst.
You have to answer those, right? But spend time with your kid.
Mm-hmm.
Make time for your kid,
Mm-hmm.
right? Make time for your loved ones, right? And that's your husband or your wife. Uh, Nurture your relationship.
Mm-hmm.
In other words, support your support systems,
Right.
because those are the ones who will help you when you need them,
Mm-hmm.
right? Enrich your life with spiritual stuff,
Mm-hmm.
right? Involve and connect to communities that are positive and not negative,
Mm-hmm.
right?
Like-minded.
Like, yeah. Practice gratitude.
Mm-hmm.
And I guess one way of doing that is showing empathy for persons who may be less fortunate for yourself.
Mm-hmm.
Volunteer. I know these sounds really silly, right? But believe me, they're and I guess it's all about balancing off the chaos of this world and putting an intentional purpose to it.
Mm-hmm.
And by that I mean, yes, I have to work 40 hours, but I also have to manage my home.
Mm-hmm.
And I have an obligation to my community. And I also have to be connected to my spiritual self.
Mm-hmm.
And I must look up for those who are less fortunate than me,
Mm-hmm.
And those guiding posts sometimes get enveloped in, I have to do this for the boss. I
Mm-hmm.
have to get this paperwork done, and
Mm-hmm.
I have to work on this thing, and I can meet the PDA meeting today,
Mm-hmm.
and I can meet oh my God, right? And so when you're in that position, or when you're operating in that space, uh, you know that you're off balance,
Mm-hmm.
and not that being off balance will lead to this ghastly thing, but when you're off balance, you're operating without supports.
Mm-hmm.
And if you don't have any supports, the vagaries of life is such that bad things will happen.
Right.
And when bad things happen and you don't have those supports,
Mm-hmm.
then worse things happen.
Mm-hmm.
So balance it off,
Yeah.
support your supports, and obligate yourself to things that are much more important after the 40 hours,
Yeah.
which is family.
Yeah. I'll tell this story as we close. I have a friend of mine who's very, very busy in their work life. And we were talking off and on the weekend, and at one point they sent a message to say, "Oh, well, I'm visiting my grandmother, and it's the only grandparent that they have left, and they were taking them like sugarcane and avocado, right? And just send a photo of them just kind of laying up in the bed, talking and hanging out and chilling. And it's just like, it's things like that, right? Because
Yes.
you find spaces where you just decompress and disconnect from, not to sound cheesy or cliche, but like the hustle and bustle, and you get to connect with yourself, with your, like you said, your support network, to support you support.
Yes.
But I do think it's things like that people, it may sound silly when people hear it, but at the same time, if you practice it, if you engage in it, you may find that it's very helpful in bringing you back to center and bringing you back to a point where it's like you can put all of the different aspects of your life in the proper alignment and with the proper percentages of, this much to work and this much to home and this much to, like you said, your spiritual self and your community and all of these different aspects. And what you may find is in doing all of those things at the right levels, you end up in a space where you're more balanced and you're more able to weather the storms of life. You're more able to find hope in the middle of what may be otherwise seem like hopeless situations.
I absolutely agree.
Yeah.
That's exactly what I'm saying.
Yeah.
Right.
Understood. So thank you very much for a very great conversation. Dr. Thomas Smith, psychiatrist here at Doctors Hospital, talking through World Suicide Prevention Day. Thank you very much for taking time out of your busy schedule to join us.
You're most welcome.
All right. And so for our listeners, we invite you to like, comment, subscribe, and most importantly, share. And we will see you back here next week on the Doctors Hospital podcast.
When accuracy, efficiency, and simplicity matter, choose Doctors Hospital Laboratory Services. We are the premier outpatient laboratory service in the Bahamas, delivering timely results you can trust. Experience the ease of testing with us. Accurate, fast, and hassle-free. Doctors Hospital Laboratory Services, where precision meets convenience. Give us a call at 302-4759 to get started today.